name is Julie. I work with Gen 5. We're really excited to start this webinar. We're here today with Marissa and Melissa, our IVF BFFs, and we're going to be talking about family chiropractic care today. We're joined with Dr. Sydney Hook. She works with Cafe of Life in Pacific Beach. And if you can go ahead and introduce yourself a little bit, talk about what you do.
Yeah, I'm Dr. Sydney Hook, and I'm a family chiropractor, and I specialize in pregnancy and pediatrics, which is kind of different. When you first hear about chiropractic, your brain doesn't normally go to that. But my whole practice is centered around family health and anything from priming the body for pregnancy through postnatal and taking care of baby.
Great. So kind of getting into the chiropractic care, I think one of the common questions maybe is it safe for women that are experiencing infertility or for women that are going through this fertility journey?
Absolutely. So not only is it safe, but it's a great tool to incorporate with infertility. And a lot of women seek care during that process, mostly because chiropractic in general, the objective is to influence the nervous system. And the nervous system is comprised of the brain, the spinal cord, and all the nerves that come out of it, right? And it's also the only system in the body completely housed in bone. Mm-hmm. So our body knew it was pretty important before we did.
Right.
And when there's stress on the spine, there's stress on the nervous system. And when those nerves go to every cell, tissue, muscle, organ, everything like that, including the reproductive organs, we want them functioning at their best. Mm-hmm. So what we do is we ensure that the spine is moving great so that the nerves can function great so that mom has the best chance of pregnancy.
Right. For women that are seeking chiropractic care, that are going through this fertility journey, when is the best time that they can start? And what kind of things do you assess when they come in initially?
So the best time to start is the sooner the better. So a lot of women that are struggling with infertility come in obviously before they're pregnant in order to prime their body and get it working as best as possible before that journey. And then I have patients that come in at 38 weeks when they're right about to give birth, whether that's because they're in pain or baby's in a non-optimal position, things like that. But it's never too early, and it's technically never too late to start care, just depending on what our goals are.
How often do they come in when they're preparing for pregnancy?
So people that are preparing for pregnancy usually are on some kind of regular schedule. Mm-hmm. And depending on where their body's at when they come in and the analysis that we do, checking their spine, making sure the joints are moving, any pre-existing conditions that they have, we talk about, which can also impair with their body functions. Sometimes regular care looks like once a week. Sometimes regular care looks like once every other week. Sometimes it looks like multiple times a week. Mm. So it's all tailored to how that person presents, because there's no one size fits all, and our practice kind of reflects that.
Mm-hmm. Yeah, that's how we are as well.
Yeah, I love that.
Based on that, are there any times during the IVF cycle that you think might be a good time to go, or maybe a time they should avoid to go?
I think just based on Sydney's kind of presentation of how and when you do this type of treatment, I would think that any time during the cycle would be okay. Mm-hmm. Just because the manipulation that she's going to do is not going to impact the ovaries or the pelvic area when they're stimulating. And then for pregnancy, early on in pregnancy, we know exactly where they're at in their pregnancy, and when they've been cleared by us, after their first heartbeat ultrasound would be then, I would say, the next time they could be able to see you.
Mm-hmm. Yeah. Okay. So how do adjustments for pregnant women and non-pregnant women, how do they differ?
That's a great question. So one of the techniques that we use for pregnant women is called the Webster technique. And it's a specific technique tailored to women that are pregnant, because women that aren't pregnant, or people that aren't pregnant, we take care of, dads too, they're included, or partners. But people that aren't pregnant have less going on, obviously, with uterine ligaments and muscles and things surrounding that. So when you're pregnant, we use a Webster technique, which focuses on, I have this cute little pelvis model, which I'll use right now. So your sacrum, or the bottom most part of your spine, sits right here, and your hip bone's right here. Your uterus sits in the middle. What Webster is designed to do is assess the pelvic joints back here. They're supposed to move when you walk. Sometimes when we're sitting all day, they don't, which isn't great. And also when you're pregnant, it puts excess stress on those joints just naturally. And then you have all those wonderful ligaments that are tethering the uterus down. And when there's excess stress on one side or the other, it could change the shape of the uterus, change mom's comfort level, things like that. So a lot of times we'll check not only the pubic symphysis, the sacrum, the ilium, but we'll also check tension on things like the round ligament, the broad ligaments, things like that, and release tension. And also, obviously, pregnant women get the comfy pillows so that they can lay face down, which a lot of times they're like, I just want to stay here because I can finally lay face down. But yeah, that's the majority of the difference.
Okay. What are some common, common symptoms that pregnant women come in to get checked out? Yeah,
most of the time, obviously, low back pain is a huge one. As the belly goes forward, the low back caves in even more, and you get a hyperlordosis, which puts excess stress on the spine, causing pain. Another one is the round ligament pain, that like lightning crotch feeling, the pulling on the ligaments, and then anything from headaches to women that just want the most optimal pregnancy they could possibly have and don't want to wait until pain starts, and they just want to stay good or neutral for that time.
How can you tell if infertility is related to a spine issue?
So there's no red button that tells me that it's related to the spine, but the way that we approach pregnancy or infertility in chiropractic is we know that the body functions best when there's the least amount of tension on the nervous system, which means there's the least amount of tension or stress on the spine. So the way that this is kind of me geeking out because I love this stuff, but the nervous system is split into two branches, right? So you have the sympathetic branch, which is the fight or flight. Then you have the parasympathetic branch, which is the rest and digest. Now the sympathetic, which is the stress response one, is super important because back in the day when we would be like hunters and gatherers and there would be a lion, you switch on to the sympathetic, the blood goes to the big muscles, you get out of there, and then we toggle out of it. Today, instead of lions that sympathetic response triggers, it's carpool, it's emails, it's a lot of things in our daily life that we get stuck in this fight or flight state. And what the adjustment does is it actually triggers the nervous system to be more in the parasympathetic state. So when you're more in the parasympathetic state, rest, digest, also known as feed and fornicate, because there's more blood going to the reproductive organs, things like that, the body can function more efficiently. Right. So we know that if you're in a more parasympathetic state, then the nervous system functions better.
Do you think that there are like those natural factors that affect your ability to conceive?
Yeah, I mean, stress is a big factor when you're going through fertility. I mean, most patients are experiencing that throughout the whole process. From the moment that they've been diagnosed that they can't, or they're having difficulty trying to conceive through the actual treatment process. So being able to be in a better state of mind and health is very beneficial to a patient.
And I feel like what you were going over, how would chiropractic care, I guess, help those kinds of factors to help, people who are trying to conceive?
So same thing. Stress is like the umbrella term for a lot of dysfunction in the body. Chiropractic specifically, yes, we're addressing more of the structural stress aspect, but chiropractors talk about the three main types of stress, which is the physical stress, which is structural, and then emotional and chemical, which is more like emotional is obviously mental stress, anxiety, things like that. And then chemical is diet and things like that, because that adds stress on the body too. So I do go over diet, nutrition with people that are trying to get pregnant or are pregnant. But I also talk and bring awareness to those topics because they all play an important role, even though chiropractic mostly deals with the structural stress.
Right. Okay. And do you think that there are other treatments or lifestyle changes that you could recommend to people who are going through IVF to kind of increase the success of it?
Well, one thing that we recommend to all of our patients is we do encourage them to eat a more healthier diet through this process. We recommend acupuncture too, to relieve some of the stressors that come along with going through fertility treatment. So from diet to different forms of exercise, meditation, to acupuncture are all kind of recommended prior to IVF cycles. I think, as you talk about the adjustments, we talked about, sleeping better. Patients that are going through this don't sleep well at all. There's so much going on in their mind, and they're mentally exhausted, physically exhausted. Their hormones are out, aren't where they're normally at. And so, just sleep alone will be beneficial. So being adjusted to help with sleep will help them get through IVF itself.
Okay. And I guess lastly, what do you think women benefit from chiropractic in terms of like the postnatal time?
Yeah, the postnatal period to me is huge and quite frankly overlooked. The way that medicine kind of shapes it is after that 6 weeks, boom, you're good, do whatever you want. But that's not always the case. And a lot of times there's mental healing, emotional healing that has to take place. That doesn't stop at 6 weeks. And same with the physical healing. Yes, your uterus might not fall out if they give you the go, but that doesn't always mean going to work out. After that 6 week mark, I usually check for diastasis recti, which is separation of the abdomen, because a lot of women like to jump back right into working out and things like that. And the body might not necessarily be ready and might be doing more harm than good. So things that you might not think chiropractors check for, and some might not, but especially dealing with women in that postpartum period, I think it's really important to have like a holistic view.
Right.
And also create space for wherever they're at emotionally and mentally and offer some support. But like I said, all these joints in the pelvis during birth, they all get shifted, obviously, which is beautiful that the body can kind of come apart and come back together to birth the baby. However, when it comes back together, it's not always specifically correct. So working with the body in that healing phase, really, really gently to ensure that the healing heals correctly is huge to avoid any long-term pain or like residual side effects of birth.
Okay. What is the timeline for IVF to embryo transfer?
Yeah, it's about a 3 to 4 month process. Patients will, be doing pre-treatment for an IVF cycle. That's roughly 4 weeks. And then IVF stimulation is about average 10 days with the egg retrieval 2 days later. And then an embryo transfer cycle is roughly 6 to 8 weeks in preparation for transfer.
Okay. And what would be the best times to get chiropractic work done during that timeline?
The sooner the better. I've worked with women that have struggled with infertility and started care before the IVF process. And then others that have started at various times throughout the IVF process. And obviously we tailor the adjustments to their comfort level and how they're feeling that day. But there's no specific time to avoid, just more times to modify adjustments according to what's going on.
Okay.
So definitely a pre-treatment phase. So if they were going to start IVF when they're in pre-treatment, haven't started their stimulation medication, that would be the best time if you're being proactive.
Okay.
Yeah.
And also like priming the body.
Yeah.
If we think of pregnancy and birth as a marathon,
Yeah.
the training leading up to it
Right.
makes a huge difference.
Exactly.
We have another question. Is there a certain qualification that they should look for when selecting a chiropractor?
Yeah, so most people looking for a chiropractor that deals with pregnancy or fertility and things like that, they'll be a family chiropractor, and more specifically a Webster certified chiropractor, because again, they deal with pregnancy specific adjustments and tend to know a little bit more about processes that around pregnancy, like IVF and infertility and things like that. but also just calling and seeing if you can call any chiropractor and ask if they see pregnant women. And a lot of chiropractors refer to my office because they don't necessarily specialize in that. So it's great to call and just ask.
So I think this can go for both, the IVF treatment as well as the chiropractic, but do you tailor treatment specific to each patient?
Totally. And depending on, again, what they come in with, any pre-existing conditions, somebody with high blood pressure is definitely not going to get the same adjustment as somebody without it. Somebody that has any history of trauma that doesn't feel comfortable in a certain position, modify that. It's a pretty intimate relationship with a chiropractor. Somebody's touching your body. So I really like to take the time to make sure that there's a comfort level and a trust there before we start.
And I think that goes to, the same with IVF, but
Yes.
Totally.
I think, and Marissa can speak on this as well, for IVF, there may be some things that are done standard, but everything is very individualized on the patient, individually based on their diagnosis, their hormone levels, their reason for fertility. That's all done individualized by Dr. Wood. Yeah.
And Marissa, have you found any correlation between patients who get chiropractic work or any other kind of services and their fertility successes?
Yeah, I feel like a lot of my patients who do, and I do have patients who do chiropractic services and acupuncture services as well. They're just, I can see a difference in their treatment by their less stress. I mean, they're still stressed, but they have more of a, I guess, calm, yeah, that's a good word, but just calm going into the process. Because we have those patients who are kind of stressed and they don't know what to do. And then we have those other patients who are more comfortable, like, I've got a plan, and they kind of take it cool. And so I can kind of see a difference. And their outcomes are great. I mean, embryo transfers when we do acupuncture or even chiropractor, they all turn out wonderful. And we have great outcomes. Yeah, I can see a difference. That's right.
I think it just in their demeanor, their mannerism, their just their overall presence is very different.
Right.
Yeah, they seem more relaxed and then less anxious, because embryo transfer phase is a very anxiety-inducing process.
Although it's the funnest stage, it's
yeah,
the most
yeah,
anxiety.
Yeah.
Or you get the most anxiety in that stage. So
because they've worked so hard to get to that point.
And it's nice to have something like that.
Yeah.
Like I always tell my patients, find something. If you don't want to do acupuncture, you don't want to do chiropractor, you don't want to do that type of medicine, then find something that can help de-stress, because this is something where you need to go in and just trust the process and try to get the best outcome.
Yeah, totally. Feeling supported.
Yeah.
Are there things that they can prepare for, I guess, prior to that whole IVF cycle or process?
So, I mean, there's a few things. I mean, we have a list of hormone levels to get checked. We have, exams to be done. Everyone, as a female woman, we want to be proactive in our health anyways. And so there are some things like, annual exams, making sure you're current with your own personal health. Make sure you've had a current pap smear. Make sure you've had a mammogram if it's needed, or at least a breast exam. You want to make sure you're preparing your body for a pregnancy. That's the end goal, is a pregnancy and live birth, hopefully at the end. So there's a lot of things that we try to work through with our patients, and making sure they're working on certain items to be completed, because ultimately we'd like to correct anything if we need to, and make the proper adjustments to that patient. And so we give them a list of things to start working on in preparation before IVF, and then things before embryo transfer, should they not have been completed beforehand.
How, I think this question can go for both topics, but how quickly can they get started? I know we talked about, as soon as possible, but how realistically, like how quickly?
To get started with IVF, or
Mhm.
okay, so if they haven't already had a consultation with the doctor, have a consultation first. A treatment plan is then discussed for that patient, and then they get started with their pre-treatment. Then they get started on that checklist of things that they make sure they've done. And some of the patients have already done them, and so it's not a big of a deal. But if they haven't done them yet, we can do them at Gen 5. We work on a calendar for the patient to get going, and fairly quickly. I mean, if they're ready to move forward, we don't have any types of limitations for patients.
Mhm.
We don't have like a wait list
Mm-mm.
to start the treatment,
Okay.
but it all is dependent on that individual person. So if they have regular periods, then most of the time you can start right away. Or if their hormone levels are in the ideal state, then we can start right away, or start the process right away. But if they're not, then it may take some time. But we say plan for about 4 months from the start of IVF to an embryo transfer cycle. And then during that time, where we're waiting to start the stimulation for an IVF cycle or the embryo transfer cycle, they should be working on the list that Melissa indicated, and also starting to create those habits of acupuncture or chiropractor, or chiropractic medicine, or whatever, because a lot of patients, when they're going through this the first time, they don't realize how stressful it can be, and we want to help guide them to the best resources to make it less stressful.
Right.
Because a lot of women are doing this for the first time. We also have women who've been doing this many years or have done many cycles, but still we guide them to, hey, start adding this into your lifestyle.
Mm-hmm.
And I think too is we know time is of the essence for a lot of these women that have come here after multiple cycles elsewhere. And so we don't want to waste time. We want to be able to move forward quickly with them, but we are, again, trying to be more proactive and making sure that everything has been assessed and we are not missing anything. We want to make sure every T's crossed, every I's dotted.
Right.
So, yeah. But I love for chiropractic medicine is being proactive and starting before their IVF even starts.
Right.
Get going on that. Yeah. So that when they do start, they're ready.
Totally.
Yeah.
Thank you guys for having me.
Yeah.
I like being on this.
I know. Thanks for joining us. It was fun.
Yeah.
We're glad that everyone can join and hope for a positive outcome for everybody.
Yeah.
Yeah, it's definitely great to have, resources for people who are experiencing or going through the fertility journey. We would love to always be a great support system for everybody.
Yeah.
Thank you for joining us today. Again, if you have any questions, please feel free to contact us. Follow our social media. We post updates on there, all the time, every week. And yeah, thank you. Bye.
Thank you. Bye.